You're listening to Systemic Error Podcast. The failure was designed.
Trump cuts blamed as explosive diarrhea outbreak spreads unchecked, based on an article by Brad Reed, Common Dreams. The outbreak was predictable. The surveillance collapse was chosen. Public health was not ignored by accident. Cyclospora is now documented in more than 24 states, and the reporting says the source still has not been identified. That is the surface story. The real story is that the federal machinery meant to track outbreaks has been hollowed out, and the people doing the damage are not anonymous. The Trump administration, with Robert F. Kennedy Jr. running HHS, has made surveillance weaker, reporting optional, and day-to-day federal tracking unreliable. The people with power chose retreat. This is not a mystery of administrative confusion. It is a decision structure. David Freedman says state health departments are now the ones forced to speak up because the CDC is not following the outbreak the way it used to. Omer Awan says mass firings at HHS have stripped out the very employees who track these outbreaks, and that as of July 2025 the CDC no longer requires cyclosporiasis reporting. That matters because outbreaks do not investigate themselves. If the federal government removes staff and then makes reporting optional, it is not falling behind. It is disarming itself in public. Misdirection is built into the frame. The article gestures toward Taco Bell because some sick people ate there before getting ill. That may be part of the investigation, but it is not the center of gravity. The source also makes clear that other infected people had not eaten there. Yet the public narrative instinct is always to chase the brand name, as if the political problem were a chain restaurant and not a gutted surveillance system. That is how institutions launder responsibility. They let attention settle on the most legible private actor while the public apparatus that failed to detect, require, and trace the outbreak slips out of frame. Deliberate harm gets called confusion. The reporting gives away the deeper pattern. Freedman, Awan, and Protect Our Care all point to the same thing from different angles. The CDC is not operating at full capacity, and the federal government is making that worse. The outbreak is spreading across states while Washington makes states do the detective work. That is not mere incompetence. It is what it looks like when anti-public health politics produces measurable consequences and then hides behind the language of administration. Cuts, laid off, optional to report are bureaucratic phrases for a political choice to accept more illness as collateral damage. The pattern is larger than one parasite. Cyclospora is the event. Surveillance collapse is the governing model. The same coalition that treats public health as an inconvenience also treats data collection as expendable and emergency readiness as waste. Then, when people get sick, the blame drifts downward toward restaurants, states, and confused consumers instead of landing where the power sits, at HHS, at the CDC, and with the administration that engineered the decline. The lesson is not that the system failed on its own. The lesson is that public health can be sabotaged from the top, and when that happens the harm arrives wearing the mask of uncertainty. You've been listening to Systemic Error. Thanks to Raw Story for today's article. With the automated voice of Sam, thanks for listening.